So we're in our third week of the InterX lectures and focusing more on chronic and neuropathic pain this week and learning some different techniques. And I'll hand it over to you, Zulia, to start.
I'm glad there are still people standing. Yes, third week. Today is probably most important day because we're going to talk about patients, the kind of patients you see, but also I want to bring sort of all elements together, not just talking about specifically pain, but the whole sort of holism of how you should look at the patient to understand how the best to help patients. So today I'm going to start with sharing the presentation. Understanding complex neuropathic pain and advanced InterX treatment techniques. So we look at the face point scalp treatment. How do we treat there? What do we find there? And why we do this? Most importantly, treatment of the abdomen and use of acupuncture points in our protocols. Why? Because we work with the skin, and as you know, the skin is really important organ because it's extension of the nervous system. The skin also conducts electrical currents through bioimpedance mechanism, and we know the acupuncture points, they have low impedance, just like neurological junctions. So that's why it's all included in this protocol. And then I share with some case studies. Right. First of all, I want to bring you to attention the concept of the stress response. So it's evolutionary with us. And if we didn't respond with stress, we would have been dead as species. We would not survive. So what does it mean? It means that whenever we see any concept of danger, there is a predictable set of reactions of our body goes through. So number one, we see the danger, or maybe we smell it, or maybe we perceive it in a different way. But information travels to various nuclei in the brain and create the following response, like you want to run away. So the blood runs to the muscles and you run away because it's a danger. Your heart starts pumping up more blood. So this is a basic stress response as we were taught and at school. But also I would like you to understand a little bit more what is happening physiologically in our body. So what we have, so-called fight or flight response, yes? And what I want to tell you is one thing, is nobody was telling you before, is that these processes of fight or flight, they are hugely energy demanding for the body, yes? So this is process number one, what is happening in the body. Whenever you see life and death situation, or you experiencing it, what's going to be happening, the process of gluconeogenesis. So you basically summon all sugar from the body and you start breaking down to make energy. And whilst you've gone through all your resources of sugar, then you go through your fats. So mobilization of the fatty acids for energy processes. And when the body is completely run out of these processes, then you start breaking down proteins for energy. So what is important to understand here is that whenever body is in stress, we're gonna burn everything, all our resource for energy, because all the reactions we're gonna do is all energy demanding. So what's happening in reality with inflammation? Well, we cannot run inflammation when we're in stress response, okay? So inflammation, as you know, it's a protective reaction. It's the first stage of recovery. Last time we discussed this, yeah? The body has to go through inflammatory phase, then through phase of creating, integrating tissue, creating scar, and then remodeling it if you have damage in any tissue in the body. So with stress response reaction, there is no energy resource to run inflammation, because inflammation is hugely energy demanding. So whenever you're in stress response, you're going to suppress that inflammation. So there will be a decrease phagocytosis, decrease of white blood cells migration. So your immune system is slowing down, decrease white blood cells lymphocyte production. So you'd say, well, this is a really good thing, right? It's because that's what we've been taught for last, I don't know, 50 years. It's not, because that means our body is unable to complete the process for healing a specific injury or specific state, like we talk about, let's say, tremendous surgery, yeah? So redistribution of resources. So by suppressing white cells, your body then shift energy into making a lot more red cells. Why? Because remember, you have to run away from this danger. And you also redirect blood flow. The blood flow is redirected to the muscles, and it's depletes on or reduce flow to the internal organs. So with that, you have also one process, which is decreased insulin sensitivity, because remember, insulin is a hormone of the storage. Yes, it stores sugars, it stores fats in our body as a source for fuel. And if it's very active, it's gonna try to still store this hormones that the insulin try to stop storing sugars and fats. And so you have to decrease this insulin sensitivity, because you need everything, all for the sake of fuel. And with these processes is not only centrally mediated, but they mediated together with endocrine system. So you see the change in the hormones and endocrine glands function. So I call it hormone redistribution. So number one priority is going to go to stress hormone cortisol. So your adrenal glands are going to fire and fire epinephrine, norepinephrine, all that stress hormones going to be fired. And what at this stage, you cannot optimize metabolism in the body. So thyroid gland is suppressed. Yes. And what another process you don't want at the moment of life and death, it's procreation. So your sex glands are suppressed. Yes. So the whole hormonal system is going to be dysregulated. And this is fair enough if you want to survive. Yes, you severe, shock, the trauma, road accident. You need these processes, because if you don't have this in place, you simply die. So this is fair enough for a short period of time. But what we see in hospitals now, especially with our very complex patients, is this process continue to run. It's ongoing stress response, okay? Ongoing, the body is stuck in this stress, and it cannot get out of this. So ongoing stress response is driven by epinephrine stimulation. So epinephrine, it's adrenaline, simplistically say, and these receptors of epinephrine scattered all over the body, including in the gut, yes? So what's happened if these all processes I described, they run non-stop literally. So you basically summons all the energy, and eventually you decrease energy resources in the whole of the body. So with decrease of this energy, what's going to be happening with the sugar? Yes, the sugar is going to do yo-yo, because the insulin sensitivity is down, and whatever sugar you have, it's straight into bloodstream, straight delivered to the muscles, and you try to burn it. Yes, cholesterol is going to be the fatty acids will be also used as a sugar. So you can see presence of cholesterol in the blood. And guess what? When you go and do blood works, what you're going to see there, increased blood sugar, increased cholesterol. And what immediately doctor is going to put you in a box of diabetes. but it's not really diabetes. I mean, there are obviously situations with diabetes, but it's a stress response. It's a, remember this, because the body changed body physiology altogether. Because your body cannot run inflammation because it's really energy demanding. So what's happening? There is no immune system adequate response and suppression of white cells. So what it leads to? It leads to microbial overgrowth. So pocket of chronic inflammations. And typically pocket of chronic inflammations where your teeth, your sinuses, your cystitis, anywhere there where, you know, a little bit space where microbes, and of course, a gut, microbes are gonna really flourish there. So there will be chronic inflammation all over the body. Why chronic? Because you don't have resources to complete it. Now you see the inflammation in an entirely different way. So chronic inflammation in the body always accompanied by dysregulation, mitochondrial dysregulation. Yes, you're gonna have lack of oxygen. Lack of oxygen give you sense of achy pain, and then of course the muscles won't be able to act adequately. Yes, so muscles will be in quite in a spasm, and when you have an ongoing continuous muscular spasm, so there is a very poor blood flow in the body, which restricts resources delivery, restrict delivery of oxygen, restrict delivery of nutrients. And of course, it has also compression. It compresses on the blood vessels, muscles compress on the nerves, give you extra sensation of pain and neuropathic even element of pain. And gastrointestinal disturbance. Why? Because basically your gut is not functioning properly. Remember, I talk about dysregulation of the hormones. You have also dysregulation of the serotonin. When serotonin, which is regulated by the spleen, is not produced in the gut adequately, the gut has a motility issue. So food is propelled slowly because there is no presence of serotonin, and then very fast when there's suddenly bunch of serotonin is released. Yes, so you have this situation when the gut becomes swollen because there are some food and food is not properly digested, and so you could see there is a debris of the unfinished proteins, and these proteins, they create so-called they basically alien for the body. So your body say, I don't recognize this protein because it came from a chicken or beef I ate yesterday. And so, but it's not completely broken down. So it starts producing antibodies. So you have this autoimmune reactions to it. In addition, you have food sitting there, sugars and fermenting in the bowel. And then what's happening with the bowel permeability? Permeability is increased, so this little debris escape in the blood, so leaky gut syndrome. In addition to this, the process of fermentation gives you lots of bloating, and in addition to this, you have also basically malnourishment because you don't make nutrients out of food you eat. And lots of people, even eating really well, if they're in a stress response, they won't be able to digest. Just think of the situation when you enjoy your food and suddenly you receive a phone call, and this phone call is telling you some tremendous news. Yes. After that, you can't eat because you lost all your appetite. You're unable to digest. That's what's happening if you have ongoing response in the gut. And because you don't have sufficient amount of nutrients, you cannot, you have poor rate of recovery. You cannot repair adequately because you don't have building blocks for repair. Inability to detox, why? Because remember the blood continuously going into the muscles and flowing out of the internal organs. So you have organ dysfunction and you become toxic and poor sleep. Of course, inability to sleep is one of the most important indication of the stress, ongoing stress, because you constantly firing adrenaline. Yes, And so when you fire in adrenaline, you cannot sleep, you cannot relax. And so eventually, first you produce lots of adrenaline, but eventually you're going to exhaust your adrenal glands. And then you see in the blood works, you also see low cortisol level. And you think, well, there is no stress here. No, I assure you there is a stress, but it's just ongoing and out of control. And it's a state of exhaustion when you see this on your test results. And gland dysregulation, what's happening? Hypothyroidism, because the metabolism slows down, because just to redirect resources into energy, your sex hormones are down, so you have low libido, all hormonal dysregulation, all of it. Liver is not working well, pancreas is not working well. You have low melatonin production and dysregulated circadian rhythm. And patients like this gain weight, yeah? So tell me, have you seen this patient before? And you say, yes, of course, I have seen it. I have seen it. And when you see this such a complex situation, when everything goes wrong, which could go wrong, what one thing you could do? If you apply logical thinking, you can say, this is, yeah, I go back. The name of the slide, it says sympathetic overdrive. So stress, it's your sympathetic nervous system, keep running and running and running. And just a little journey into the past, which talk about sympathetic and parasympathetic system. This has to be dynamic balance in the body. So sympathetic when you run out of danger, when you're active, when you work and exercising, fight or flight, sympathetic activity dominates. And parasympathetic when you relax, when you rest, digest, when you make love, that is parasympathetic, yeah? So you have balance between two systems. So what's happening if only one sympathetic is up, then your parasympathetic will be down, because they should be in balance, but one, if it's like a boat, one side is up, the other goes down. So the answer is for you, you need to turn off that stress response. Can you see this switch on and off? So if your sympathetic is on all the time, you need to turn it off. And that will be your first step to stop the body running like crazy in this stress, ongoing stress response. And how do you do this? Yes, variety of things. You know, people tell you, go into breathing exercise, go into this, but really you need energy to do that. You need energy. And so that's why InterX come as a very handy tool. This is the only tool out of all tools I have known in my entire life, which can get you in the parasympathetic state within 10 minutes. Within 10 minutes, we have studies to prove that. So within 10 minutes, you can switch into parasympathetic state. So here is a little diagram of the hypothalamus, because remember what's happening once we start sending impulses from InterX, the part of information travels into hypothalamus. And this is where you have pituitary gland, where you have hypophysis, yes, and where the processes for water balance and stress regulated here, hunger, appetites, reproduction, thermoregulation, sleep-wake, and satiety, yes. So all of these functions is there. And when within 10 minutes, we can give energy to the body and we reach that switch and we turn it off. This is what needs to be done. And I always ask this question, what can you do? Or what can you ask one single question and find out that person is in this sympathetic overdrive? One single question, I'll tell you what you should do. Ask your patients about your sleep, yes? And say, how do you sleep? And if patient says, I don't sleep well, I wake up through night all the time, or I can't fall asleep, yes? This poor sleep is indication of sympathetic overdrive. this would be for you a sign this something is going on here. So the treatment protocol, my recommendation to you, if you deal with such a complex patient who is in pain, of course, is going to be pain syndrome prevalent in these patients. However, what you need to do first, you need to get them into parasympathetic relaxation. So let's introduce you to concept of parasympathetic zone as number one. So parasympathetic zones. Six points on the face, or 6 trigeminal points on the face. This is the first protocol you need to do. And this is first protocol, which you use your InterX, you use the small classic electrode if you have. If not, you have to use half of the electrode of the device, but this is much more handy. And you choose the anatomical points of exit of the trigeminal nerve, yes? So get you on Google the map, and this map will show you where the points. I'm just going to show you right now on myself. So I stop share for the moment. And then put this speaker view. Right. Okay, I come very close to the screen. So the first set of points, they are very easy to find. They're on the jaw. If something wrong with this trigeminal nerve, you feel sensitivity. So the half of the electrode, it goes to this fold here. So corner of the lip, yeah. And you can see that half of electrode is in skin contact and half is still hanging. And half is still hanging, yes. So this is a point number one, and I put it at angle. It's easier this way. And then like that, at angle, and it's easier this way. Second set of points, the orbit, the bony parts of the eye sockets, yes, they call orbits. Try to palpate with your fingers. It's a little incisions here, and then there is the nerve is coming out just like that. So you can feel it's there. Try to feel this nerve in everybody, and somebody is going to tell me, oh, this is sensitive for me. So that is sensitization of the trigeminal nerve. So how to do this? You put the InterX device, again, half of in skin contact and half is not. And you put it at angle like that, okay? And you can see I still can open my eye, I still operate my eye. It's not in the eye point, okay? You target in these 2 points. The next set of points, they are on the orbit, but in this part, so underneath your eyebrows. Everybody's different, but this is the orbit, and this is a little incision here. So palpate it on yourself and tell me if anybody feels sensitivity. And then you put the InterX like this. You can see I'm still looking at you, and half of the electrode is hanging, and I put this at angle as well. So some people have bushy eyebrows. If it's the case, you need to move the eyebrow forward and then up, and then you stick the electrode, and then you lift the eyebrow. It's hanging there, yeah? So I still can operate my eye. This is important to get the points right. Okay, so we're back to our diagram. You can see here, first 2 points, second and third. How do we do this? We set device to chronic. Remember, because these people are neuropathic and chronic. So we set it to preset 15. Remember, 15. It's our preset. And you can point stim, of course, but really they are so important because this is a cranial nerve that delivers information straight into your brain, yes? So it slows you down immediately. I recommend you to treat each of the point for 2 minutes. So altogether you have 12 minutes you spend just on this point. How to best to do? Patient is lying on the couch and you just sit relaxed and you just place it. But remember the intensity. If patient is neuropathic patient, only vibration level. If it's a hypersensitive neuropathic patient, vibration level. But if people not hypersensitive, you can get to very, very mild tingling sensation. And that is so relaxing. I highly recommend you to try it on yourself to understand what it feels like. And after 12 minutes, you would feel absolutely relaxed. You want to sleep, you want to just chill, okay? So you could use for yourself when you're stressed. The second protocol I want to introduce to you, it's called scalp treatment, So for this reason, you're gonna use the comb attachment, yes? And you need to work in this direction like it shows here on the diagram. So you start moving from hairline all the way down to the occipital fossa, the point of joining scalp and the neck, okay? And you're gonna go very slowly like this. And then you go like the technique called watermelon, and you, as if you seeing the stripes on the watermelon, yes? So you go like this, but always bringing your the comb attachment into the back of the scalp. So when you work like this, you know, you place it like this. You will see on your device symbol, you have a contact, green symbol, you start reading activity readings. Make sure the patient feels it, but also very delicate, very gentle feel. And then you move on like one step at a time, all the way like this. In people who are bald, you can continuously glide over the scalp. But what I found, people who's got hair, it's difficult to glide it, yes? So you're gonna mostly be working step by step, but very tiny step, because what you need to do, you need to find that sensitive part. And guess what? The sensitive part would be exactly where the pathological process happening in the brain. So for example, post-stroke patients would, for example, spasm on the left side, you'd find over the right side, you'd find somewhere here, for example, a sensitive patch. What happened when sensitive patch you found? You need to do your 4-directional sliding technique. You just keep working on it. You want to distribute this. And if you do this, if it will be effective. And I would ask Bev to talk to you about her experience, how much it's helping spastic patients. It's quite a technique which she developed. So this is the protocol of the working. So this protocol you do for about 15 minutes. So settings for you, 15 to 60 pulses per second. 10 minutes or so you work over the scalp, and then you find something, you work on it. Typically, I tell you where you're gonna feel. Here on the, above the ear. It's actually very interesting because these points are sensitive, but they are following the gallbladder meridian. Gallbladder meridian goes over the side of the body. Yeah, often the actual occipital fossa is sensitive because there is a very big acupuncture point. Super, super important. So whatever you find with the patient, you need to stop there, focus there, and do 4-directional sliding technique if you can. If not, just at least focus for a few minutes and do a few strokes there. So this is number one technique which we do to induce parasympathetic relaxation. Next parasympathetic zone is to use flexible array over the area of the body. So you could do just one zone or you could do both. If you have double pad, you could do actually very good thing is you could do like a sandwich. Okay, double pad is you can have it one over the pubic and the other in the sacrum area. Yeah, and then you could do back of the neck again. What's cycle to use? I recommend you cycle 3 So remember, cycle runs for 10 minutes. So you can have 10 minutes here, 10 minutes here, 10 minutes here. So this is all very important areas. That's areas of parasympathetic innervation, and neck is a mixed sympathetic, parasympathetic. And lastly, you can do this area. So if you don't know acupuncture, you just have to just slide over this area, yeah? But if you understand acupuncture, you can actually look it up. There is a combination of points. It's called pericardium 6. Pericardium 6 is often used in medicine too. It's an anesthetic point. So it runs in between two tendons, probably approximately inch. And if you slide your finger, you always find acupuncture points. It's a little indent in the skin, yeah? So there, in between two fingers. So if you put big head InterX or classic head of InterX, you will be able to immediately detect it. The sensation will travel into ring finger and middle finger. So once you get this sensation, stay on this point. And then combine this point here underneath the pisiformis little indent. So this is heart 7. Combination of both give you the, it's called parasympathetic switch in acupuncture. So if you want to slow down heart, if you want to slow down stress immediately, it works like a switch. So it's like more or less immediate effect. I recommend you to include in your treatment protocol. Now let's talk about nerve, map of the nerve points. Okay, this is a work, I think I have somewhere reference to these points. This is the points which been identified and described in the monogram by Dr. Ma. Dr. Ma is he's medical doctor and acupuncture, I think from California. And in his clinic, they analyzed 10,000 patients for sensitivity. So they palpated different, they are in a sense acupuncture points, but they are very crucial points. And they palpated each patient at these points, and they kept the record and saying how many points were sensitive in overall patients population. And it was really remarkable that this, they 24 on each side and one right in the middle. So it's 49 points, yes. So they were sensitive at different degree. And what they found that in all research of 10,000 patients, the 1 point was present in all 10,000 patients. And there was a point, he called it number one point. And it is an acupuncture point. But he decided to call this point by the name of the nerve which innervates this point. And this is very good because now we're not talking about abstract acupuncture concept. We talk about anatomical location of sensitized neural junction. Okay, so the very first number one deep radial point, I show you where it's located. It's on your elbow. If you drive on this, if you press the, not very good screen. If you press the, with your thumb, this nerve, deep radial nerve, against the radial nerve, radial bone, so you could see there is a, when you press, there is a sensitivity there. So most people on earth, they have this point sensitive. You can palpate it on yourself. We're gonna go through the points in a minute, but this is an idea. And then in a lesser degree, he found number two, like a little bit less frequently occurring in patients. And this point is called great auricular points. And you could see it here. Great auricular points locates in between the sternocleidomastoid muscle and the ear and the mandibular. Yes, so there is a right in the ear, you feel it. So if you press this nerve, great auricular nerve, against sternocleidomastoid muscles, you feel sensitivity. Most people do this as well. And then at lesser frequent occurrence, there will be point number 3. So point number 3, it's spinal accessory following its own trapezius muscle. Again, I've got it. The other 2 were okay, but this one I feel it because spend most time on computer and so on. So you can see, so the numbering of the point represents how frequently they occur in the population per se. So this is an indication to you. So we took this research. It's really, really interesting. I mean, I highly recommend you to read this book. I will leave in the chat when we finish the name for it, or better I pass it to Bev to redistribute with you to read. And so what we have done, we studied this research, and then we thought, if we use our InterX device on most occurring points, what's going to happen? And we picked 12 points. 12 points on each side, which make it 24 points, which will take approximately half an hour of your time. So yeah, first 12 points, most occurring points, we included in our treatment protocol. And what we discovered, it was amazing, amazing results, because if you work on these points in the sequence, which suggested by Dr. Ma, what we got really nice pain relief in neuropathic patients. And we use these protocols now numerous times, and it definitely works. So how to treat it? So we're going to choose chronic presets. It's either going to be 15 for hypersensitive or 60 for not hypersensitive people. We adjust level to comfortable vibration or tingling. And then we apply to 12 bilaterally points, neuropathic points. Yes. How we physically do it, when you place the device on the skin, you need to find the point first. When you find the point, you can see I'm twisting it like a radio button until I find the sensation of spreading sensation along the meridian, or at least spreading around the point. Yes, this, when you have this buzzy sensation, that means you find the point. From that point onwards, just point steam. Okay, you can stay 1 minute as well, or just point steam, and then you go one bilaterally, one after another. But always you have to be very, very comfortable. Okay, this is anatomical location of the point. I can go through this with you, but really, I think I'm going to let you to read it through, because it just explains. So deep radial nerve is one of the terminal branches of the brachial plexus, and 4 centimeters distal to lateral epicondyle, there is a radial nerve branches into 2, superficial and deep. And so we targeting deep branch, which then innervates musculus brachioradialis and extensor carpi radialis longus. Yes. So the point is just there. Great auricula I described for you, spinal accessory also I described for you, but you should know that it's also cranial root of the spinal root C1 and C6. So the branch of spinal accessory nerve enters trapezius muscles at the point over the shoulder bridge and in the middle of the edge of trapezius. So point number 3. Point number 4 suddenly takes you to the leg. Why? Remember I told you the sequence is super important. You don't just treat all these points, you just follow the sequence or numbering of the point. It's basically when you stimulate top of the body first, and you will notice it's kind of following the magistral nerves. So you go top, bottom, top, bottom, and you're covering the way, it's actually following the way the body's becomes sensitized. You know, neural sensitization process, yes? So it's like spreading this information, spreading through the nerve and make the nerve to be sensitive. So number 4, saphenous, it's located on the medial side of the knee, below the epicondyle of the tibia. This is in the innervation between lumbar 2 and lumbar 4. So it's just there, yeah? So if you palpate and it's sensitive, you say, I know there is a problem with your lumbar spine. You can put also the pads to lumbar spine. Deep fibula, number 5. Yes, this is lever 3 in acupuncture, very famous point. Tibial, number 6, it's a spring point in acupuncture. Great occipital, now you can all the way up to the attachment of the trapezius muscle to the scalp. So that's your number 7. And number 8, it's infraspinatus muscle. It's just literally in the middle of the scapula, if you look. Then you have lateral antebrachial. It's literally very easy to find. It will be on the end of the crease, end of the elbow crease. That is the point. Sural, number 10. Number 10, it's again very easy. You slide your finger, and when you sense there is a muscle divides by 2, so calf muscle divides by 2, sole muscle, and that is the point. Lateral or medial popliteal, so that is here, again, very easy to find, literally at the insertion points of that. And finally, superficial radial. And superficial radial, we know we often use in InterX, it's called large intestine 4 point. So if you do this point in this sequence, you are going to get phenomenal results with neuropathic pain. Now, how do we treat abdomen? Abdomen, this is the area. I normally start always treat through the back. So I scan lumbosacral area, okay, when patient is sitting. Of course, if you have difficult patient and lying down, so lying down prone, you scan, you use accordingly settings. It's either 15 to 60 or 30 to 120. But when you scan either on 60 or 15, depending on what is the situation. And then you turn the patient over. If you have spare device, put the pads underneath and put cycle 3. And then you work over the stomach. But you can see this is a rectangle I draw, the borderline of the abdomen area. So it goes through the xiphoid process of the top side of the body, pubic bone here. All of it is abdomen. So you need to glide and slide and look for any sticky points in this area. If you know the alarm points of acupuncture, you can use it as well. So this is an example of the how would you treat, let's say, complex regional pain or fibromyalgia. So if you're talking about complex regional pain, so you have start away from the damaged limb, So it's, you start here. I recommend to start with the head, yeah? Treat the head zone. So you have 6 points on the face, comb. You done this 12 minutes, 10 minutes, and maybe treat one of these as well for half an hour, yes? If you have 2 devices, you can do simultaneously. You stimulate like a sandwich, the sacral area and low abdomen of the pubic bone. And then at the same time, you do these points, and then you add parasympathetic switch. So this put patient into parasympathetic relaxation. And your goal is to desensitize your patients, Approximately on the 4th session, you will see your patients is already no longer produce neuropathic pain, the signs, it still may be in pain, but maybe it's skeletal muscular. Yeah. If there's still neuropathic pain continues, you need to add this protocol for 12 neuropathic points. And also, one of the sessions, couple of the sessions, you should do abdomen. I personally do abdomen on every single session. I do all of it, but I use 4 devices. I have a personal device which I use to put underneath the pads, pads underneath the spine and maybe pubic area. With active device, I do points, and then I complete with treating the abdomen. If you feel that it's problem with fascia, like fibromyalgia would be related to fascia, I would also do, I would use my soft tissue release electrode and do fascia release, or fascia release. Okay, and okay, so if you did parasympathetic zones at the beginning, then you start switching to 12 neuropathic points, then you do, for example, next session 12 neuropathic point, then you go back to parasympathetic, next session 12 neuropathic point, then you go for abdomen, and maybe 6 points. You can mix and match those the way you like, but the idea that you need to focus on those areas. Maybe in one session you do lots of soft tissue release, next session, so on. So mix and match this, alternate these zones. So how often? Remember, we don't want to treat too often. Once a week is sufficient, and don't do too long. My recommendation, stick to 30 minutes, because within 30 minutes you don't aggravate. If you go 40 minutes, 45 minutes, you might have aggravate your patient, but if you've done 1 hour, you're most definitely going to have an aggravation. So now I'll quickly introduce your protocol. It's called source points protocol. Source points protocol you can do not often, but in the patients who are not in pain. Okay. An example, for example, you treated and you successfully treated and no longer patients in pain, but you want some kind of to balance them. So this protocol is very good for balancing. And you could see here, it's altogether, again, 24 points, but they all located around the wrist. In acupuncture, this is points, they call them source points, which reflect each energetic meridian, and it kind of keeps the blueprint of the meridians. Like, for example, this is a heart meridian, so blueprint of how much energy should be in the heart meridian for it sufficient for its function. Yes. So I mean, for most of you, maybe it's alien concept, but trust me, the protocol works. So don't worry how we arrive to this conclusion, but it works. So what you do, you just use these points, and they're very, very simple to find. With your finger, if you slide, for example, here, you have an indentation. Each point has an indent, yes? And you could see the little dip in the skin. So you can find every of the acupuncture points, but this one, they are big. If you follow the placing this device just over this area, even if you don't know what you do, you can stimulate this. But most important to get that sensation, buzzy sensation. So if you work like this, and this is the point over there, this is a point over the joints. You can always find the acupuncture point sits in the dip over the joints. Yes. So this of the condyle and sorry, malleolus. Malleolus. You can put it here, and this is a phalange of the last metatarsal bone of the last toe, and so on. So you could see where to place your InterX, and then you use the accordingly settings, typically 60 pulse per second. And this is a list of the meridians. Somebody asked, so I put it together. So we come into the end, and I just want to talk to you about a few case studies which I have. They're very interesting, trust me. So this is a guy who had a saw chain accident. So he literally cut through the all the way to the bone and immediately went to surgery. A brilliant surgeon, stitched absolutely everything, perfect, every nerve, every blood vessel. Microsurgery was phenomenal. And so he wanted to use InterX for recovery. Actually, for this patient, I use both InterX and laser. I had also laser device in my clinic. So, of course, you work over the scar, but the biggest problem came to when he came is that lack of sensitivity in these three fingers, because it's a damaged radial nerve. And you can see blotchy skin here and nothing here. So this is already indication, visual indication that there was no proper blood supply and nerve supply to these three fingers and distribution of the radial nerve. So we treated him locally, we treated him cervical area, we use InterX on variety of settings, on all three variables. And he used it at home. I use a little bit of laser, red and infrared laser. And so on and on, I was treating him sporadically, but at the beginning once a week. In 9 months, that's the result, yeah? You could see here the blotchiness, that lack of blotchiness gone, and now you can see normal hand. So within 9 months, he got to the point that only tip of his finger would not feel, rest of his, and a fully operationable hand, everything healed. So I've seen this patient even now, he's completely utterly recovered, or already within 1 year, he was totally, absolutely recovered. There was a tiny little scar. You could see, by the way, how much scar improved from here to there. But guess what? Now it's just tiny little white line, and that's all of his injury. Disc hernia, I treated lots of disc hernias. You can have acute disc hernia or chronic. Of course, both of them are difficult to manage, and it depends on the age, vitality, and with chronic disc hernia, it can actually create oversensitization for the patient. But this guy with this case study, he came with shoulder pain, swollen shoulder, and of course they've done X-ray only on the shoulder. They couldn't find anything, so I treated his neck, and when I scanned his neck, this point here, which corresponds to C5, showed. I don't know, I don't remember how much, but it was something ridiculous, like 450 on the readings compared to shoulder, which was in the mid 50s. So altogether, this immediately I thought there was hernia. We did MRI scan, there was hernia. And as a result, he had the personal device rented, treated himself 4 times a day with personal. I treated him once a week for 3 weeks. Each time his pain from 10 out of 10 dropped down to 5 out of 10. And by week 3, 2 out of 10. So he recovered fast. With this girl, it took a little bit longer to recover because it's more or less chronic disc protrusion. And so she recovered probably, I would say, extra 2 weeks. But there was a full recovery. In a very, very bad case of disc hernia, the worst one I treated for 4 months. Yeah, but it's still better than normally if you go to a surgeon, they tell you 2 years recovery and lots of drugs. And when you take drugs, it's a problematic. Now, complex regional pain syndrome, injury 3 years ago. So it's about 3 years ago, she developed a neuropathic pain allodynia. She came in flip-flops. That's how I remember her. in the November in England. It was very cold. So we did one session a week, first months, and she already started feeling some improvement. And then she rented the personal device, and she was treating every other day herself at home. And I saw her once a week. And within 3 months, we basically, allodynia completely arrested, even on the first months. But neuropathic pain disappeared after 2 months. And left metatarsal phalangeal joint was still locking, but it's become nociceptive pain, so not neuropathic, which was easier to work because then we can work locally. Remember, if the patient hypersensitive neuropathic, you do not treat where the pain presents. You go on the head, central zone, and that's what I did with her. I treated lots of parasympathetic zones. I treated her spine. Then she was coming, her neck was become painful, so I was treating her neck. Then mid-thoracic, I treated her mid-thoracic. Then the hip, and then eventually she said, "Oh, that foot, the only is pain here." So we treated there, and then it's resolved. And roughly, I would say within 4 months, I stopped treating her. She bought the personal device, and she worked at home whenever she had pain. And then 3 years later, I received a letter from her, and she said she's fully recovered, back to work. She was very pleased with that. She also had what is happening with the circulation, cold and purple food with the allodynia. Another complex regional pain syndrome. This time it's a very young person, 17 years old, and following the injury and surgery, and she developed neuropathic pain, came on crutches. She had vasoconstriction. I took picture with my thermal camera. It was really interesting to see that is cold. You can see purple, it's so cold. And normal skin, it's yellow orangey, and hot skin is white. So what you can see, the process started spreading on the opposite toe. And so treated her, first treatment, again, parasympathetic points, not the foot. And spine, we use 6 trigeminal points, yes. So no allodynia after first session. So she was really pleased. And after first session, she came with no crutches. And then she was coming within 4 weeks. We brought her pain down to 2. And you could see that blood started to flow into her feet. Yeah. But what happened then, the inflammation. So we re-inflamed the original injury. And so she was in less pain. She was quite functional. But a few months later, she contacted me and she said, the screw, which was there to fix her joint after skiing accident, the screw started to bother her and pain came back because of the screw. So I told her that she needs to remove the screw and then do the treatment. But she had the personal device, so she self-managed. Overall, it's basically, I don't know what was the latest, but it was very quick recovery. Bell's palsy. With this patient, what you could see, that is very active Bell's palsy. And this active Bell's palsy, in response to the virus, she came to me straight away. I treated her 6 points on the face, dermatomes, facial dermatomes with InterX. Treated her glands, treated her points, large intestine 4, because that's related to the head. And I use laser on 6 points as well. But anyway, she recovered within 3 weeks, look completely fine. And this is a patient post-stroke, because you asking me, many of you asking me about post-stroke. And post-stroke, this guy was 18 months post-stroke. I just random, because I was flying over the town. I went to see the patient there. I treated him for 3 days, no, 4 days, I remember. And in these 4 days, treating his, he had stroke, slow recovery, yes. So over this bald, he's got shaved hair, and all the head, all the spine, soft tissue release, abdomen, you know, I treated all the points. There was no pain. And this is remarkable patient. He actually wrote a book. If you like, I can share with the book about his experience. He used InterX actively. He used lasers. He used light device, LED device, flex beam. He used nutritional and physio. Oh my God, he did probably 6 hours workout every day. He fully recovered from the stroke. That was before first day when I arrived. See how unstable he is? And this is after 4 days I treated him. Walking without a stick, much stronger. And this is just InterX device here. It's much stronger. Of course, assisted and everything. Three days later. Okay. Thank you so much for attending the course. And we try to do it very concise, because normally I do like 4 sessions on the course. So you have it all. I tell you, for some of your patients, it will be life-changing experience. It was certainly for many of my patients. So my goal and mission is just to pass the knowledge so you could do exactly and get phenomenal results like I get in my practice. And so really, please use, just go ahead and use. You don't know something, please contact Bev or me and we will help you.